My name is Dianne Cormier Northrup, and I'm a mom of two adult children, Robert and Lynn. Here they are. They live independently in their own home with 24/7 support and have created a pretty good life for themselves, filled with things they enjoy to do and people who care for them, like their family, friends, neighbors, and a devoted team of support workers that help them manage the ups and downs of life. But this COVID pandemic has created problems for Robert and Lynn and their network that we're all struggling to cope with. Because of their physical condition, of course, avoiding the virus is a matter of life and death for Robert and Lynn. So we all fear what would happen to them if they ever needed to be hospitalized, God forbid, because of this virus. They would be totally helpless and totally vulnerable, given that patients that go into the hospital can't be accompanied and they need help to communicate. So my biggest worry, though, really on top of all that, is whether they would even get the necessary medical treatment, especially given that in some situations where the number of COVID cases outnumbered the available resources, triage was done. And given the response that's been happening in the world in Canada, I'm concerned about it, really. And me, well, I'm really worried and concerned, but I'm also very frustrated as days go by, weeks go by, and we still haven't heard anything from our government about how they're going to support my children and other persons with disabilities. It's almost as if the persons with disabilities have dropped off the world, like they don't exist. And even worse, it almost feels to me as a mom that they don't matter. And it's a horrible feeling to have. Robert and Lynn's lives matter, and our government needs to step up, and they need to start doing something like they're doing for other vulnerable populations. But you know what? I'm really lucky because I'm not alone in believing this, and that's why I reached out to the Canadian Association for Community Living. It's been working tirelessly for all other kinds of causes, and they're doing it for this. And I just hope I hold that hope that they're pleased with the federal government to provide the financial support that they need and maybe the rights-based guidelines that for healthcare that's needed, that maybe the government will hear them and something will happen. Because in reality, my children's lives depend on it.